The pubis is one of the three major bones that fuse together to compose the pelvic girdle, commonly known as the hip bone and the os coxae. The pubis is ventral and anterior to the ischium and ilium. It is the most anterior portion of the coxal bone. The pubis can be found in both sides of the pelvic girdle. Let's start off with the pubic rami. When referred to individually, the pubic rami is known as the pubic ramus. The pubis has a superior and an inferior ramus. Fusion of the pubic rami anteriorly and the ischium posteriorly forms a bar of bone enclosing the obturator foramen, through which blood vessels and nerve run from the pelvic cavity into the thigh. The pubic rami serve to help protect various organs of the body, including the colon and the bladder. Pubic rami fractures are the most common pelvic fracture pattern, especially in individuals who are over 60 years old. From a lateral view, the body of the pubis is visible. The body of the pubis creates the wide, strong, medial and flat portion of the pubis which unite anteriorly at the pubic crest. This forms a fibrocutaneous joint called the pubic symphysis. This structure is a non-synovial infrathoracial joint, meaning that it has no true free movement. This is where the pubis of each bone come together. This joint works with the superior rami to aid in activities such as walking or even delivering a baby. A good way to remember the location of the pubis symphysis is to know that it is anterior to the urinary bladder. At the lateral end of the pubic crest, the pubic tubercles are found. The pubic tubercle is a prominent forward projecting lump on the upper border of the medial portion of the superior ramus of the pubis. This structure provides attachment to the inguinal ligament. The inguinal ligament supports the region around the groin, preventing inguinal hernia or protrusion of part of the intestines into the muscles of the groin. An inguinal hernia is more common in men than it is in females. Another structure that is part of the pubis is the pubic arch. The angle at which this arch converges is known as the subcubic angle. A subcubic angle of 50 to 82 degrees indicates male. An angle of 90 degrees indicates that the skeleton is a female. This is one of the first things investigators look at when examining a body to determine the sex of the skeleton. The reason the female arch is wider is because the pelvis of a female is adapted for childbearing rather than physical strength. The pubis is fused to the ilium and ischium at the acetabellum. The acetabellum is round in shape and a concave surface in the lateral portion of the pelvis. This is where the head of the femur meets with the pelvis, forming the hip joint. The hip joint is a ball and socket synovial type joint designed to be a stable, weight-bearing joint. Fracture to the acetabellum either occur with high energy trauma, like an auto collision, or as an insufficiency fracture. In younger patients, there is almost always significant trauma associated with the fracture. In elderly patients, acetabular fractures can occur due to bone weakening from osteoporosis. Some women suffer from symphysis pubic dysfunction, also known as SPD, during pregnancy. SPD causes the ligaments that normally keep the pelvic bone aligned during pregnancy to relax and stretchy. This makes the pelvic joint unstable, which can lead to pain.